Hello, everybody. Thank you for listening to the Healthy Project podcast. I am your host, Corey Dion Lewis. I have a great guest in the building today. He's the new CEO of Broadlawns Medical Center here in Des Moines. I have Dr. Anthony B. Coleman. Dr. Coleman, thank you so much for being on the podcast with me today. I appreciate it.
No, thank you. Thanks for this opportunity. I appreciate being able to talk about what's going on at Broadlawns and kind of share my thoughts on healthcare in Des Moines and the way forward.
Yeah, absolutely. So, before we begin talking about, everything that's going on, how about you tell the people a little bit about yourself and, what gets you up in the morning?
No, absolutely. A little bit about me. I'm from California, born and raised in Los Angeles, and moved to Des Moines specifically for this opportunity. I never had been to Des Moines before now, but I really enjoy it here. The people are really nice, and the communities are really nice, and y'all got some good food too. I think to answer the second part of your question about what gets me up in the morning, my passion, simply put, and my passion is eliminating health disparities and ensuring health justice. And so those two things get me out of bed in the morning.
Awesome. And I was a part of that Nazi speak you did, a few weeks ago, and you talked a lot about health justice. And can you talk about that a little bit more and kind of, what are some of the things that you feel like that are important that we need to be working on?
No, absolutely. When you say we, do you mean the hospital or just the healthcare community or the
healthcare community in general?
Sure. No, sure. So when we talk about health justice, we talk about removing the barriers that cause health inequities in the first place. And a lot of those barriers take place outside of the hospital. Barriers like access to healthy food, access to adequate housing, occupations with a living wage that provide health insurance. Those are all really they're social determinants of health. And the absence of those things create barriers to health justice. And so in the health community, our job specifically, as we speak to those barriers, is, well, the biggest part of our job is to ensure that we provide health care in an equitable way. And what I mean by that is when individuals come to our hospital for care, it's our absolute job and duty to make sure that we provide the same level of health care regardless of the background of our patient. And so what I mean is that if we have whether we have a patient that is relatively wealthy and comes from means, or we have a patient that, is poor or underrepresented, or even, we'll say like a refugee who really doesn't have access to a lot of the same things that we have access to. Health equity means that we treat those two patients the same regardless of their background. That's our job, and we can do that. We have the opportunity to do that really well and really hit a home run in the walls of the hospital just by how we treat each other, how we treat our patients. But health equity is the journey, and health justice is the goal. They work together.
Right. So it's not one without the other. It all has to come together.
Right.
So I know you haven't been at Broadlawns for that long, and I know you have a background of population health and a great background. But can you kind of walk me through when you first got here and you're trying to get a handle on maybe some of the health inequities in Des Moines, and just trying to figure out, how you can best support the community? What was that process like? And, trying to figure that out, not like you said before, not even ever being in Iowa.
Yeah, no, that's a great question. I'm actually still in the process of figuring it out, but I can tell you that it always starts with listening and learning and watching. I'm in the process now of meeting with people in the community, meeting with community leaders, community organizations, meeting with the staff here at the hospital, and really just listening to their concerns. They're going to tell you what's going on. You just have to listen. Um, and so that typically takes, anywhere between 3 to 4 months, depending on the size of the undertaking. But yeah, the first thing you have to do is listen. You have to be with the people and be where the people are and listen to what they have to say, because they'll tell you exactly what's going on. And so that kind of informs the direction that I go, or what my battle rhythm will be, so to speak, in terms of tackling health inequities. You first have to, again, you just have to listen to the people that are living in the communities and experiencing those inequities that you aim to resolve.
Right, right. And what are some of the, are there any similarities? 'Cause I know you, like you said, you came from California. I know you're at Kaiser Permanente, your whole different culture. Are there any similarities compared to, communities in California and communities here in the Midwest that you've noticed so far?
Yeah, no, absolutely. You have access issues everywhere, just simply because of the way that our healthcare system is structured. You have access issues where certain people have more access to healthcare than others. And so when I was at my previous job in California, it was the same thing. The demographic was different. The majority of my population in California was Hispanic, and so then the majority of the disparities were in the Hispanic population. Um, but it's the same everywhere. No matter where you go, if you don't have to look too hard to see that they're going to be the haves and the have-nots. I think as time goes on, you're going to see that line or that divide become deeper, just because of our political structure. There's a very thin line, if any, between healthcare and politics, and so the political structure and the political stance that the nation seems to be taking exacerbates the difference between the haves and the have-nots. But for the most part, it's the same.
I can see that being, I mean, especially for being a healthcare leader, in that line between politics and healthcare being a thin line, and one that can go, it can go left pretty easily. It feels like, what is that like, trying to walk that line and make sure, one, you're doing what you're supposed to help the people in the community, but also, you're running a business in a way, and trying to, make both people happy.
Yeah, I think that's a really interesting question. The first thing that I keep before me is that you can't please everybody, and you'll go crazy if you try. Um, you're right. This is a business, but it's a unique business in the sense that in this business, people die every day, and there's no coming back from that. And so I think that we have to look at healthcare a little bit differently than any other industry, because a lot of the deaths are completely preventable. And our job in healthcare is done. You can't really measure the success of our job, but our job is done successfully when you make it to those birthday parties and when you have that extra Christmas with your family, things that you can't really measure. And so for me, I think I just, as we run this business, I just keep before me the delicacy of humanity. People that have family members and loved ones that I want to make sure they get to spend as much time together as possible, and just do everything with humanity, and keeping the human element before me in every decision that I make.
Right. No, that's good. That's good. Um, when we're talking about, I know, we work at, Broadlawns, which is safety net hospital. Um, we serve a lot of people, a lot of, minority immigrant population. When you're thinking about solutions, and you're thinking about, okay, how can we be in the community? What are some of the things that come to mind when when knowing, like, hey, we're serving a large immigrant population, a large, black and brown community? What's that thought process?
Get out of my office. Get out of my office. get out of the hospital, go into the community, spend time with these folks, spend time walking the streets, driving the streets, turning the corners, and find out what's really going on at the ground level, because that's going to inform how you operate in the hospital. Just get out of my office, meet with people, listen, do more listening than I do talking, because the demographics are changing. If you look at the 2020 census, the Des Moines metro area is the fastest growing metro in the Midwest. And so that demand signal is changing every day. And, I wouldn't presume to know how to meet that demand from my desk or from my
Right.
office. You've got to get out of your desk. You've got to get out of your office. You've got to get out in the street and meet the people and be one with the people. That's how you find out what's going on and what they need. So
Right.
that's
Right.
that's kind of a the answer is a little more. It's not as simple, but that's the number one. That's the foundation. You got to get from behind your desk. You got to get out of your office.
Right. It's one thing seeing the stats in front of you on your desk and seeing what they're saying about the community, but it's a whole nother thing when you're hearing it from the actual people.
Absolutely, data can be manipulated to say anything you want it to say. You know, and
Hmm.
we have to trust and verify. And so I can see data that informs or points me in a particular direction, but again, it's not until I get out from behind my desk and see it with my own eyes that it becomes real to me. I'll give you an example. I met with the CEO of the YMCA. Wonderful meeting, wonderful young lady. The YMCA is doing some great things in the Des Moines area. And she mentioned a transitional housing program. And it was fascinating to hear her talk about it. But it didn't really come to life in my mind until I got in my car and I drove down there and I saw that building and I saw the individual residents outside. That's when it became real to me. And that's when I realized that it was more than just a notion. So, yeah, you have to get out from behind your desk.
Right, right. And that brings up another question for me, Dr. Coleman, is partnerships in the community. How important is that not only to, Broadlawns and to have those partnerships, but also for the health outcomes of the people?
Yeah, partnerships are imperative. We can't do anything alone. And any person that's experienced any measure of success, if they're honest, they will tell you that they didn't do it alone. When we talk about health justice and when we talk about dismantling the social determinants of health, that happens outside the walls of the hospital. That happens with partnerships. As a hospital, I can't, and I'm under no illusion that I can do it all by myself. I can't provide adequate housing and education and healthy foods as a hospital. I can't do it. I have to have partnerships with other like-minded individuals and nonprofits in the community. So it's absolutely essential. You can't have any measure of success without partnership.
Right, absolutely. So to kind of go into a different way here as far as talking about leadership, this is something that's really been in the conversations with a lot of my friends, specifically talking about leadership, minority leadership, and how, especially with the population that I serve, seeing someone like you or working for someone like you is really important, especially when I'm seeing a patient. If I'm seeing an African American patient and they're seeing me, there's that they feel there's that comfort there that, okay, I'm working with someone that looks like me. But specifically talking about leadership, in your opinion, how important is it to have more people of color in leadership in these leadership roles like yourself?
Yeah, you know, I, it's very important. I like to think of it as you say people of color. We're talking about diversity,
Yeah.
and there. I like to think of diversity in four different lenses. There's the ethnic diversity or people of color, and there's gender diversity, male, female. There's generational diversity, and then there's diversity with regard to sexual orientation. All four of those spectrums, if you will, of diversity must be accounted for to the extent practical. It's very important for me to see someone who looks like me do what I aim to do. Because a lot of times we all just, as human nature, we kind of get stuck in our heads and we start to doubt ourselves. But when you see somebody that looks like you doing something that you want to do, it makes it that much more attainable and that much more real. I'll give you an example. When I was in grad school, this has been 17 years ago now, I went to a conference. It was an organization called the National Association of Health Services Executives, African American Healthcare Administrators. And again, at the time I was in grad school and I had come from a background in ordnance and bombs. So I didn't know anything about healthcare, didn't know anything about healthcare leaders. I was a, 25-year-old African American young man, aiming to do something that I had never done before. And I went to this conference and I saw African Americans in roles that I had only heard about, in roles that, quite frankly, I didn't even think that I could achieve. But when I saw them and when they extended their hand to me and had conversations with me, and some even offered to mentor me, that's when I knew that I could do it. Now, I could do it all along, but to know that I could do it made such a difference in the way that I approached my goals. It made a difference in the way that I carried myself when I went back to school and finished my master's degree. It's so important. Representation matters. You see that a lot.
Yeah.
Representation, it is so true. And it was that conference was the turning point for me, and just really just in school, honestly saying, not thinking I was smart enough to finish grad school and telling myself, well, I'm going to take this as far as I can take it, to walking back with confidence, knowing that I could do it and knowing that the way had been paved for me. So it's very, very important to see. And I'm just talking about from an ethnic perspective. That happens from a generational perspective. That happens from a sexual orientation perspective. We have to, as leaders, promote diversity. Diversity breeds innovation. Okay. So now,
Mm.
I've just talked about how diversity is important and representation is important in seeing what it is that we want to be, but it's also important in making decisions. This world is changing every day. It's changed during the time that we've been on the phone. And so when you have diverse thoughts and diverse ideas at the table, that breeds innovation. And when you have innovation, you get the best possible outcome. So representation and diversity is it's critical. It's very critical. And so in this hospital, we're looking at everything from the diversity lens, from an internal as well as an external perspective. I'm looking at diversity on my leadership team. I'm looking at diversity in my management ranks, all the way down to the frontline staff. It's very important. It's critical, in my opinion.
Right. And it's one thing to think you can do something, but to get that is something about that cosign. Not saying we need it, but it's something about that cosign from somebody that represents you. That's like, okay, it takes you from a confidence level of an 8 to a 10, and it takes you from where you're at to, the CEO of wherever. And yeah, sorry, go ahead.
No, I was just going to agree with you. You have to, sometimes it takes somebody to tell you that you can do it. You could probably do it all along, but it's someone that looks like you and has walked that walk that you're currently walking to look at you and tell you that you can do it, and they know you can do it. Man, sometimes that's all you need to hear.
Right, right. So for that young kid out there that may be in grad school, undergrad, doesn't have that mentor listening to this episode, what's one thing that they can do you know, to get to where they see themselves, they just don't know that route, that plan. What's one thing they can do to kind of get on track?
Yeah, I think the first thing is just believe that you can do it. Believe that you can do it, and study hard, study everything that you can. Because when you study and you broaden your horizon, rather, things that seem to be out of touch become a little bit closer to your reach. But first you have to believe that you can do it. There was a quote. There was this old quote that I love music. So there was a quote that Barry Gordy used to say to Diana Ross. He would say, if you can think it, you can do it. And that's what I tell people. If you can think it, you can do it. So you have to think it and believe it, and you can sure enough do it.
Awesome. Well, hey, we've talked about diversity, we've talked about innovation, but I'm really excited to take those two things and see, your thoughts on where do you see Broadlawns going from here? We've gotten to a great place so far, but where do you see Broadlawns in the future with diversity in mind and with innovation in mind?
No, absolutely. I see Broadlawns nurturing deeper and more sacred relationships with the community. I see Broadlawns being more of a nimble healthcare provider in this very diverse community. I see Broadlawns really changing the way that healthcare is delivered and opening up the door to what's possible in healthcare. There's so many things, couple things that we're working on in particular that are just mind blowing, things that haven't been done in healthcare in the nation, that we're doing because somebody had the idea. So in the future, I see Broadlawns being on the cutting edge of number one, delivering efficient care to all populations, regardless of background, that health justice that we're talking about.
Right.
But I also see Broadlawns delivering a specific type of healthcare or delivering healthcare to a segment of the community that hasn't been focused on before. And I'm excited about it.
That's awesome because we at Broadlawns we really focus on. I mean, it feels like we're really known for the mental health aspect, which is a big deal. Which is definitely a big deal. But do you feel like there are a lot of other areas that Broadlawns can really be an anchor in for this community?
Absolutely. We can be an anchor in refugee healthcare. There are lots of Afghan refugees that have come to this country and have come to Iowa and Des Moines. We can be an anchor in that area, leading the way. We can be an anchor in a lot of different areas of care. Some things I really just want to talk about everything that we're working on, but I'm not at liberty to say right now. But there's some other areas that we're gonna be an anchor in. But really, the core of our business, regardless of all the other things we do or wherever else we go, the core of our business is providing efficient and equitable health care to vulnerable populations. We are a safety net hospital. We're an anchor in this community. We're a county hospital, and we're here. And Corey, there are people that are out in Des Moines walking around, talking around, experiencing quality of life and experiencing holidays and birthdays with their loved ones because of Broadlawns Medical Center, because of the level or the type of care that we provide and the nature of our business as a safety net hospital. There are people who are alive today because of the care. And so just to make sure that we stay true to that and don't ever forget why we're here. We're going to do some other things, some fantastic things, but just remember what our foundation is.
Absolutely, absolutely. Well, Dr. Coleman, thank you so much for being on with me today. I really appreciated your time. For anybody listening that wants to learn more about you, learn more about what we're doing over here at Broadlawns, or just connect with you, where can they find you? Where can they reach you?
Yeah, I would just ask them to go to the website for now. There are some other outreach avenues that we're pursuing. I'm going to look at providing a periodic update on what we're doing at Broadlawns and what we're doing in the community. What a lot of people don't know about Broadlawns, we are still a county hospital, but we don't have to look like or act like or think like what people perceive a county hospital to be. There's been some really significant changes in Broadlawns to the type of care that we provide, and we haven't really done the best job in advertising that. So a lot.
Awesome. Well, hey, again, Dr. Coleman, thank you so much for being on the podcast with me today. And everybody, thank you for listening to the Healthy Project podcast. I'll holler at you next time.